Hey everyone, welcome back. I'm Louise and I've been a nurse for over 20 years. I've worked in ICU, ER, nursing homes, cosmetic surgery, pediatrics, mental health and clinics. Today I'm sharing what it's really like in each specialty, the moments that made me laugh, cry and question my career, plus the pros and cons you need to know if you're considering one of these paths. There's nothing like walking into a patient's room, seeing their monitor crash and knowing you have seconds to act. That's ICU. ICU pushes you to your limits mentally and emotionally. You use every ounce of knowledge and skill, but you also see life and death up close. Pros: you'll master your technical skills and teamwork. Cons: it's heavy on the soul. Families remember every word you say, and those words stay with you too. I once had 3 ambulances arrive within 10 minutes, 1 heart attack, 1 overdose, 1 car accident. That's an ER shift in a nutshell. It's unpredictable, it's chaotic, and if you thrive on adrenaline, you'll love it. But it's also exhausting and you rarely see patients' outcomes after they leave your care. Pros: variety, excitement, and resourcefulness. Cons: chaos, no closure, and burnout risk. One of my residents used to sing Frank Sinatra to me every night before bed. In long-term care, you don't just care for people, you become part of their family, you build deep connections, but you're also juggling heavy patient loads and limited resources. Pros: meaningful relationships, compassion. Cons: understaffing, high workload. After years in ICU and ER, walking into a clinic where patients were excited to see me was a shock. Cosmetic surgery feels like the spa version of nursing. Healthier patients, smoother recoveries and lighter vibes, but you sometimes feel more like a concierge than a nurse. Pros: predictable, low stress. Cons: less clinical challenge. I once had a 5-year-old hooked to IV fluids who still wanted to play peekaboo with me. Kids will break your heart and make your day in the same shift. Pediatrics is rewarding and joyful, but emotionally tough when outcomes aren't good. Pros: resilient patients, family, involvement, joy. Cons: heartbreak when children suffer. A patient once told me, "You're the first person who actually listened to me." That moment changed how I see nursing forever. It's about presence, empathy, and listening more than procedures. But safety concerns and emotional burnout are real. Pros: deeply rewarding human connection. Cons: emotional weight, safety risks. Clinics may not give you adrenaline, but there's nothing like seeing a patient lower their A1C after months of working together. You celebrate those wins with them. Steady schedules, education, and long-term relationships make clinics balanced and rewarding. Pros: work-life balance, continuity of care. Cons: less excitement if you're used to acute care. After 20 years and 7 specialties, here's what I know. Every area of nursing will change you, teach you, and challenge you in its own way. If you're thinking about switching paths, I hope this gave you the inside scoop. Now tell me in the comments, what specialty are you in, or which one do you want to try? Don't forget to like, subscribe, and share with another nurse who needs this perspective. See you next time.